Hi, this is Dr. Jill Dietz, and I'm the Chief Transformation Officer at Allegheny Health Network Cancer Institute, and I'm also Director of Growth and Strategy for the breast program there. You are listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Jill Dietz, a nationally recognized breast surgeon. Doc, how are we doing today?
I'm doing great. Thanks for having me.
Thank you for being with us. So, getting started, what were your goals and aspirations during your residency, and how those changed throughout your fellowship?
Well, when I went into my surgical residency, I was just a sponge. I was all about learning and just more taking everything in. And I had no concept or idea about where I was going. I think over time that changed. I knew I wanted to use my interest in art in what I did as a surgeon, and I thought I wanted to do plastic surgery until I saw my first nose job and some of the taking dead tissue out of things, and I did not want to do that. But what I really loved, I love to do the breast reconstruction in the cancer cases. And then I had this opportunity to repeat my breast oncology rotation for 3 months, 1 year, and do it again 3 months. And that's what I fell in love with. So one of my mentors asked me if I wanted to stay on and do the first breast fellowship at the Cleveland Clinic. And I just fell in love with it. And that's what I'm still doing.
Kind of taking us through that fellowship year, what was your mentality heading into the job search process for the first time? And also how that perspective changed in the beginning years of your career?
Well, fellowship is this unique opportunity because you've already learned a lot, and yet you're not really responsible for anything yet. So it is the golden year of again, just perfecting your skill set and how, like, taking the things that you learned in residency that were very good and trying to incorporate that in your own style. And then also taking the things that you saw that were not good and saying, I will never do that. So I thought fellowship was a way to not only just learn from the surgical mentors that I had, but also, we spend time in medical oncology, we spend time in radiation oncology, with the infusion nurses and the navigators and the radiologists and the pathologists. So really the fellowship year for me was learning the spectrum of treatment that a patient undergoes with breast cancer, and also a lot about the patient journey. So it was a great year.
So as a leader in your field, what would you say were some of the keys to your success that shaped your early career as you climbed the ranks in the world?
To me, that's easy. I was trained at the Cleveland Clinic, and the Cleveland Clinic had a philosophy of patients first. The doctors all had to park farther away than the patients, and we were all taught that it's all about the patient. I'd say that combination of always focusing everything I did to be, an improvement or for the patient is the number one most important thing, because after all, without our patients, doctors are completely useless. And then the number two thing is I learned this whole concept of never say no. So, if somebody was like, I have this patient, she has this problem, I'm not sure if you're the right person, I would always take care of it and always say yes, which early on, that is a very good way to build relationships with people. I would give, well, at the time, I didn't give people my cell phone because we didn't have cell phones, but they were always able to reach me. And over time, that has morphed into probably one of my biggest problems over time, is that I still really have a hard time saying no.
And so working with residents and fellows, what advice do you have for them entering the professional job market for the first time?
I think that when you are starting out, you want to be reliable, you want to be available, you want to be friendly. You just make it easy for somebody to reach out to you, and you will be amazed as as some, especially surgeons, get older. It's almost like they figure out ways to like block other people who are trying to refer them patients, and you can move in and just say, I will take on that responsibility, I will take on that patient, you can count on me. And you'll be amazed at how quickly you build not only a clinical practice, but also start to be invited for career opportunities, on committee work, and opportunities to advance your career just by being available and friendly and responsible.
So being a female leader, what advice or direction can you give the next generation of females that may want to enter the surgical space, but might have some pushback in doing so due to lifestyles and stuff like that?
Well, I'm lucky in that, I grew up in an era where I started to have female resident partners. But I think, we've seen a lot this year and last year with the Me Too movement. And I think the downright harassment that we received early in my career, and lots of people have received, we don't really see that so much anymore. But there's still definitely a flavor of intolerance, I would say, for strong women in man's field, and especially in very high up leadership positions. There's very few chairs of surgery, so it's a little easier in breast because my field is surrounded by strong women leaders. So I guess when I'm speaking to young women residents and fellows, I tell them to, one, know their worth. And there's a tendency to want to be, I guess, self-conscious or embarrassed because there's other aspects to your life that you're worried about. Maybe it's taking care of your parents or your children. But the reality is that has been sort of beaten into us over years and years and years. And men want that too. So it's just, we feel worse about it. So one is know your worth and use data to know your worth. Talk to your friends, look at the MGM data, and share that information. The other is know what your insecurities are and where you're self-conscious about things, and work to push yourself in those situations. And then also know what is important to you. Maybe what's important to you is building your academic career, but maybe it's I want to have a very strong clinical career, and I want to focus on my family for this decade. But know what's important to you and fight for that. Don't fight for what traditionally other people say is what you should be fighting for.
And so you're involved with many national societies. Can you please touch on that, and also what resources are being provided to the next generation?
Sure. So right now I'm the chair of the Standards and Accreditation Committee for the NAPBC, which is the National Accreditation Program for Breast Centers. So there's over 600 accredited breast centers in the United States. And we basically try to improve the quality of care in those centers by providing standards. I also just came off a 2-year term as the president of the American Society of Breast surgeons and have been a program director for the fellows and the chair of that committee in the past. I'd say between the Society of Surgical Oncology and the American Society of Breast Surgeons, we take a particular interest in our incoming breast fellows. So we have special year-long classes for the fellows that are taught voluntarily by many of the members of both societies. And we teach them things that they might not be learning in their fellowship. And some of these things are about, learning how to set up a practice, learning how to negotiate a contract, learning how to build a multidisciplinary team. So a lot of the things that we don't necessarily learn in medical school and residency.
That's all it has. Anything else that you want to add in? Anything at all? Your career, your journey, anything?
Just like any journey, it's always, there's definite ups and there's definite downs. And I look at the downs as an opportunity to become more resilient and to become a stronger, more complex person. I think earlier in my career, I really focused on what people were saying to me and how it affected me and how I felt. And just as I've aged and gone through school, I'm a lifelong learner. I just finished my master's in healthcare management in May. So now I look at things a little differently, and I look at how what I'm saying could impact what somebody else is feeling. And also I look at, whenever I'm in a conflict, I say, why is that person approaching it in that way? Trying to put myself in their shoes, and also just trying to look at things from a very, outward viewpoint and not so inward.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.